Feeling confident in your skin is so much more than what you see in the mirror.
And how can you feel good? Well, that starts from within.
Welcome to the In Your Skin podcast. I'm Christy.
And I'm Anna. Join us each week as we sit down with world-leading experts and thought leaders to delve into the latest insights, groundbreaking research, and cutting-edge advancements in wellness, longevity, and beauty.
Dr Scott Allison, thank you for joining us today. You're a cosmetic physician. Firstly, what does a cosmetic physician do? And secondly, what are our listeners going to get out of our chat today?
Well, first of all, thank you so much for having me today. It's really great to be here chatting to you about skin health and aging. So I guess what a cosmetic physician is really someone that can help guide people to make empowered decisions about their appearance and the aging process. It's someone that I think has a very high level of understanding about that aging process, but how we can slow it down or perhaps, reverse that to some extent. What I hope your listeners will get out of today is just getting more of an appreciation about the three-dimensional sort of process of aging and just some of the things that they can, slow down or mitigate that, not to necessarily look 20 again, but just to look like the best version of whatever age they are.
Damn, I wanted to look 20 again.
I know. Actually, maybe not 20, maybe 30.
Yeah, 30 is good.
Yeah, 30 was good. I felt like
the sweet spot.
That was at my prime. Actually, no, I feel like I'm 40, turning 42 on Saturday.
Happy birthday for Saturday.
Thank you. And I feel like actually coming into this age now, I'm feeling much more confident in my skin. I'm, looking after myself better and therefore hopefully glowing better. I don't know. I think at the end of the day, it matters most about how you feel about yourself. But I would love to know, what made you get into your industry and what's your why?
Yeah, so I guess what initially got me interested in this industry was actually just a love or an interest of human biology and in particular human anatomy. So I did my undergraduate degree at the University of Queensland in anatomy, and I just found the whole process really, really fascinating. So we were fortunate to have a wet lab there where we could actually learn from, real models. And so that kind of spurred me on to develop an interest in medicine. So from there, I went on and studied medicine at UQ as well. And then through my early years as a doctor, we kind of rotate through different areas of the hospital. So I kind of had a bit of a taste of different areas of medicine and realized quite quickly that I enjoyed skin, and in particular, cosmetic medicine. And I think it was the combination or kind of the amalgamation of science and medicine with creativity and artistry and just having that kind of visual aspect to what I do day to day. Through my kind of cosmetic career, I've gone on and done a master's at the University of London in cosmetic medicine and also a fellowship through the Cosmetic Physicians College of Australia. And these days I combine, my weeks are kind of a combination of clinical medicine, seeing patients in my practice in Brisbane, as well as teaching other doctors and nurses about facial anatomy, how to inject safely, and just, the aging process. Another passion of mine is talking to the general public. So, you guys and your listeners, and just helping people understand what's happening with aging, why it's something that we shouldn't fear. In fact, we should embrace it. But there are things that we can do to age, really, in a positive way.
Well, I'm hoping by the end of this, and I'm going to be like, I'm happy to be my age.
Totally.
Okay, I want to start talking about what probably everybody wants to hear is what is aging, what we can do to prevent it, and just aging in general. So can you talk us through what aging is?
Yeah, so I guess the first thing to kind of take a step back about what aging is, you can broadly split it into two, facets of aging. So we call it intrinsic and extrinsic factors of aging. So the intrinsic factors are all of the biological things that are going on in our body that are largely out of our control, but not completely. And I can explain a little bit about that in a minute. But that's things like our genetics, our DNA, inflammation in the body, reactive oxygen species, and oxidative stress. The way that our cells change their mitochondrial function as we get older, all of those types of things. So we've largely thought of those as an inevitable process of aging. But the more we're learning about epigenetics and how certain genes are either turned on or turned off, we actually can influence that as well. And we do that through lifestyle changes. So things like getting a good sleep each night, having a diet that's rich in antioxidants, managing our stress, all of those types of things. So that's all our intrinsic aging. Extrinsic aging, on the other hand, are all of the external factors. So the big one for us in Australia is sun exposure. And so UV radiation, in fact, accounts for about 80% of the aging process. And in my practice, I see a lot of people will come and see me, in their 40s, 50s, and 60s. And the difference in how they have aged, whether they've used sunscreen daily or whether they haven't, is astronomical. So there's a lot that we can do in that sense as well. So that's one way to kind of conceptualize the aging process. But the other way that I think about it is three-dimensionally. So, a lot of us think about aging as what's happening in the skin. And that's certainly, part of it, development of lines, wrinkles, sun damage, all the rest of it. But in the face, there's so many more layers that also change as we age. And the way that I think about it is you've got the skin as one part of it, but deep to that, you've got the fat pads of the face. And so those are the parts of our face that give us that plumpness of youth, right? And so that changes as we age as well. And there's things we can do to kind of intervene there. We've got the muscles of the face and what they do to the skin in terms of wrinkles, but also what they do in terms of like our brow position and how that changes with age. And then finally, there's the bony changes. So if you think of the aging process, it's much more three-dimensionally than even just the skin. And so when we're putting a plan around it, we need to consider all of these things. And if we do that, we can make really meaningful change to people's aging process, but keep things looking really natural, which I think is key.
Yeah, that's really interesting. I think it would really scare a lot of kids hearing that stat about 80% of your skin damage being from the sun. That's like, if I heard that at school, my whole perception around things would have changed. And I really would have put sunscreen on a lot more back in the day because I really didn't. And that's something I always regret because you're constantly hearing that now. So
I used to lather myself in, the oil, the tanning oil.
Same.
And I grew up in the Whitsundays, hot.
But if you knew that, 80%, that is crazy. For me, that's mind blowing, and it's mind blowingly scary because I feel like the damage has been done to me. What age has the damage already been done?
So this is an interesting question because a lot of people kind of think, by the age of 18, the damage is done. What happens after that's kind of, the horse is bolted. But the research shows that that's actually not the case. And in fact, it actually doesn't matter what age that you start protecting your skin from the sun, using sunscreen, the benefits are still there. And there was actually a really interesting study done in Queensland called the Nambour Study. And what it did was it was about 1,500 people, and they split them into daily sunscreen use and then sunscreen use just when people thought they needed it. So that would be like going to the beach, popping on the sunscreen. And over about 4 years, they found that the daily sunscreen use group cut their risk of skin cancer by about 50 to 60%. And in the 10 years following, the risk of melanoma dropped in half. And this was mainly patients in their 40s, 50s, and 60s. So I guess the key message that I get out of that is that even if you're later in life, it's still so important to use sunscreen every day and protect your skin from the sun.
It's not too late.
It's never too late. It's never too late.
Good. There's hope.
Totally.
And we are all aging. We age as soon as we're born, right?
Yeah.
So that's something that we can't really prevent. But I guess the key thing is how do we age gracefully or healthily or, and you mentioned before about the lifestyle factors and epigenetics. When it comes to reversing, to say you are someone who didn't put your sunscreen on and your skin is looking much more aged than you would like it, what could we be doing in order to start reversing and getting our skin health to optimal health?
Yeah, no, great question. I mean, the cool thing with living in this day and age is there's actually so many tools and treatments at our disposal that we didn't have even, 5 years ago. I guess where I would start, for your listeners, if they're not doing anything and they just wanting to get the low hanging fruit, the thing that's going to make the biggest impact long term is getting the basics right. So, and that starts with their skincare. So for sure, the main thing is using sunscreen every day. We're probably going to say this a million times throughout the next hour.
But it's good to hear it a lot, because I feel like then it can sort of drill into people, because every time we speak to anyone when it comes to the skin, they always talk about sunscreen, and hopefully that means that people are going to start actually taking action. So you can say it, that's fine.
So I guess it's getting the basics right and optimizing your skincare routine. So using topical antioxidants and also using actives that have evidence base, behind them. So that's things like niacinamide, vitamin A derivatives, retinols, retinoids, things that we know work. If we do those things well, like everything else will work better. But
is this on a daily basis?
On a daily basis. Okay. So I guess working with a skin professional and putting together a really robust skincare routine is key. And then, of course, there's so many in-clinic things we can do, energy-based devices, lasers, all sorts of things. But I think if we're not doing the basics well, a lot of that stuff's kind of, pointless to some extent.
And then what age would you be using those topical skincare that you just mentioned in terms of the retinoids and things like that?
Yeah. Look, I personally think with the skincare side of things, the earlier the better. It's a lot easier to prevent the damage. And, by the time, I guess going back to like collagen as an example, right? So we lose collagen about 1% per year from our mid-20s. So by the time people are 30 and they're seeing the signs of collagen loss, like lines and wrinkles, they've already lost maybe 10 to 15% of their collagen. So if they're incorporating some of those things really, early in their 20s, then they can slow down that process, quite significantly. But I would just keep it really basic. If you're in your 20s, you don't need a crazy complex skin regime. You just need, again, to be doing the basics well,
Yeah, because a lot of, teens, tweens now are really at Mecca, the Sephora's.
Yeah.
They're buying all the skincare and are you thinking maybe it could be a bit more damaging? Are they doing too much too early?
I think so. I think a lot of people are doing, that's right, they're doing too much. And in fact, many people, when I see them, it's actually de-prescribing their skincare, getting them off all of the things, particularly.
What are they on? Like, what are the things they're on that they shouldn't be on?
Just too many actives. Okay. So too many things that are too strong for their skin. So often when they come and see me, people will come with quite red, inflamed, angry skin, and they think that they need to do things, put things on their skin to treat the redness. But the redness is because they're using way too many products. So it's often paring it right back and prioritizing their skin barrier function, getting that really robust and healthy, making sure their skin's hydrated, that they're using sunscreen, all of the basic stuff. And then it's slowly adding in one thing, as required. But when you're in your, teen years or even early 20s, probably most actives aren't required. The one thing I do think everyone should be using is an antioxidant because of the effect it has, because how we know oxidants damage the skin long term.
Even as a teenager?
I would say maybe from, let's say 18. Okay. It's a bit of an arbitrary number, but if you are outside a lot, like in the sun, topical antioxidants as well as your sunscreen is going to be helpful. So those are things like vitamin C would be the most common one. But as a teenager, again, it's probably just sunscreen.
Yeah. Sunscreen. And how much does genetics play a part in all of this?
Look, genetics is certainly part of the aging process. And, our genetics, of course, to some extent are hardwired. But we talked earlier about epigenetics, and what that is, for your listeners, is essentially it's how your environment influences how genes are expressed. So, for example, if we're not getting enough sleep, if we're not managing stress, if we don't have a good diet, some of those genes will get expressed in dysfunctional ways. Conversely, if we have all of those things right, the genes will get expressed in really healthy ways. So although your genes are predetermined, the way that your body expresses them can change with your environment.
And what's one of the biggest myths about aging?
I think the biggest myth in my mind is that aging is just the skin. Mm-hmm. So, when I talk to patients about aging, it's trying to educate them on the 3-dimensional nature to it. So the changes in the skin, the changes in the fat pads, the muscles and the bones. And if we put a plan around each of those things, like I said earlier, you can make really meaningful change in people's appearance, but keep things looking really natural. And I think when people start to look a little bit distorted, or if, they're seeing a practitioner that only focuses on one thing. An example I'll give are clinics that just do injectables. They just add volume and they just keep adding volume. And then people start to look strange and they look overfilled and pillow-faced. Conversely, if they're just focusing on their skin.
What's pillow-face? Is that just like
too much filler?
Puffy? Oh, okay. So it just looks
too much
you
filler.
look like a pillow?
A pillow.
A pillow?
A pillow.
Not a filler. You look like a pillow. Okay.
Yeah.
Just puffy. Yeah.
Fortunately, that's getting less common, which is great. But you really want to, think holistically, I guess is the bottom line.
That's what I was going to say. So in terms of filler and treatments like that, what are you seeing decline and what are you seeing increase in your industry? What are people getting most these days?
So fortunately, filler use or overuse is declining. So rewind 5 or 10 years and there was a lot of people walking around with very overfilled faces. So I think that's changing, which is great. So very judicious use of small amounts of filler these days is what most people would do. And there's a real kind of shift towards prioritizing skin health. So a lot of the treatments we've seen come out in the last couple of years focus on the skin health, hydration, which Anna and I were at a conference earlier in the year about. So that I think is really encouraging, is that people are prioritizing just having healthy skin and how that affects their appearance rather than just adding volume.
Why do you think that is?
I think we're just learning more about how important, the skin and the skin health is as part of the aging process. But just bearing in mind, it's just one facet to that.
Yeah, because for me, I'm somebody, I haven't had filler before. And it's something that I'm like, oh, do I want it? I'm turning 42 soon. So I'm, and then I'm starting to notice, and actually we had in a previous interview, Dr. Amy said at I think it's at 40 or just over 40, you literally your collagen drops off a cliff, she said. And I actually noticed that. I did. It was at the beginning of the year. I had this nice full, and then all of a sudden.
It was right after she said it. That's why I said, oh, yes, I know.
No, it was actually before it, but I was like, oh my God. But I went and did some skin treatments to help plump up the skin, and that worked nicely. But I think there may be a time, maybe when I'm in my late 40s, and I'm like, oh, but then thinking about filler, I'm like, okay, what are the risks? What are the concerns?
Yeah.
What are people asking you about filler when it comes to filler, and are there concerns with it?
Yeah, look, I mean, there is always going to be a need for filler, because one of the things that change as we age is we lose bone structure. And so where we lose that from is the cheekbone and the jaw. And so you can think of these as the coat hangers that the rest of the face hangs off. So as we lose bone, of course, the soft tissue then falls forward and starts to become, saggy, and it drops. So there's no real replacement for volume replacement in that sense. The only way to lift that is to put the volume back that was there. So I think there will always be a role for it, but it's just judicious use of filler. It's not just using it or overusing it. And
what's the substance made out of?
So filler's made out of hyaluronic acid. So it's a sugar that's found naturally in our skin, but the manufacturing process of filler gives it its unique physical properties. So if we're trying to, say, mimic bone, we're using a hyaluronic acid gel that's quite stiff and structural and placing it down onto bone. Conversely, at the other end of the spectrum, you've got fillers that are very lightweight, like the consistency of water or honey. And so that's what you would say put in someone's lips. So it's still all made out of the same sugar, but its physical properties in the skin are quite different.
And can it be dangerous?
There's certainly risks with filler, and we're seeing a lot of regulatory changes in our industry at the moment, and that's because there are real risks involved with filler treatments, including and not limited to blindness, stroke, so really serious things.
If you're putting it in your lips, you can still see
anywhere.
So just
anywhere. That can happen anywhere on the face. So I think it's really important that patients understand those risks, but they also do their research on who they're seeing for those treatments.
And is that the type of filler you're using?
It's actually across all types of fillers and all places on the face. And I think that's what sometimes people forget is that it is a medical procedure and it does have very real risks. So, I think the regulatory changes in our industry are
needed.
Yeah.
And so if you were someone that didn't want to get filler because you were concerned of the risks, what skin treatments could you be doing that maybe mimics something similar?
Yeah, so I think where the really exciting, part of the cosmetic industry at the moment are some of the energy-based devices. And so the concept behind those, and those are things like lasers, RF microneedling, Morpheus 8, and whatnot. The idea behind them is you're creating a controlled wounding effect in the skin, and your skin's response to that is to produce collagen and elastin. So
how effective is that?
It's really effective.
Oh, okay.
Yeah,
good.
It's really effective.
Christy's had Morpheus 8. She talks about it all the time.
Oh my God, I loved it. I was like, that's when after the collagen dropped off, I was like, what can I do?
What's the best procedure you think in terms of what we've just been talking about? What would you recommend?
So the way that I like to do treatments is what I call treatment stacking. So I'll often stack treatments together depending on what we're trying to achieve. So going back to our concept of three-dimensional aging. So Morpheus 8 and RF needling is working in that very top layer of the skin, right? So the top 1 to 2 millimeters, the dermis, but underneath the dermis, you've got the fatty layer, and then you've got the muscle layer. So there's another treatment that we do called Ultraformer, or HIFU is the common name for it. And that tightens the fatty layer. And then you've also got treatments that tighten the muscular layer as well. So I'll kind of work with patients tightening the deep layer first, the muscle layer, then the fatty layer, and then finally the skin. And so
you can use all three treatments you start with?
Yeah.
Okay.
Not in one day, but over, say, months.
So you need they really hurt most of them. Yeah, you need all three, by the way. Oh my God. They were just like numbing cream and it was like, holy shit.
Definitely one of the spiciest ones.
Very spicy. But it worked.
It's great. It's one of my favorite.
Pain is beauty.
Also, I want to touch on, we did touch a little bit on collagen, but it is such a hot topic and it has been for the last sort of couple of years and it doesn't feel like it's slowing down at all. Can you talk us through what collagen is?
Yeah. So collagen would be the most abundant protein in the body. And it's essentially the protein that gives tensile strength or fibrous strength to our tissue. So there's lots of different types of collagen, but in the skin, type 3 collagen is one of the most abundant. And it's what gives skin that kind of bounce of the youthfulness. And so as we age and with various factors, that collagen will degrade both in its density but also in its quality. So there's a lot of interest in that and how we can both slow down the loss, but also how we can stimulate it so we can reverse some of that collagen loss as we get older. And there's lots of things that we can, talk about around
tell us.
that.
What can we do? That's what the listeners want to hear.
No, so the best way to do that is to protect the collagen you've already got. And we've already spoken about that in terms of your skincare routine.
So when does it, start to decline?
I mean, really it's declining from our mid-20s.
Oh, okay. Yeah, I was like, from birth, it start to decline.
Probably to some extent, but from our mid-20s, definitely. But what's really interesting is there's actually two discrete, they call bursts of aging, and one of them's around 40, like you've possibly experiencing right now.
I know. I'm always there. She's not far behind me.
But there's lots you can do to reverse it is the bottom line.
Okay, well, we want to know
what.
This podcast wouldn't be possible without the support of our sponsor, Whoop.
Hey, Anna, what was your sleep score last night?
Well, wouldn't you like to know? No, it was 87%. What did you get?
100%.
Of course.
Whoop has me dialed in.
Okay, tell me a secret.
Well, I've been going to bed really consistently and I've been taking my Into magnesium supplement, of course. Plus, Whoop tracks my sleep performance, how much sleep I got versus what I actually needed. It even breaks down into 4 stages: awake, light, REM, and deep sleep.
Well, that's what I love about it. Whoop auto detects my sleep and it helps me stay consistent. Plus, the sleep coach gives me a personalized bedtime so I wake up feeling refreshed.
Exactly. Sleep is the foundation to everything. Recovery, performance, and even how I feel during the day. Whoop helps me optimize it.
Well, want better sleep? Well, head to whoop.com and get a free month when you sign up. If you want to try it yourself, sign up at joinwhoop.com/inyourskin and get your first month free. Okay, well, we want to know what.
So
you're talking through this.
Okay, so we've talked about skincare. The lasers and energy-based devices are really cool. Mm-hmm. But the other thing that is really interesting is what's called regenerative aesthetics. And the idea behind that is harnessing your own biology to produce the result. So those are things like PRP.
What's PRP?
Platelet-rich plasma. So taking the patient's blood and then injecting it back into the skin.
I've seen that. Kim Kardashian does it.
She kind of made it very famous.
And it works?
It does. Yeah, it does to some extent.
How often do you need to do it?
That one's usually done monthly.
Okay. For how long?
For like 4 to 6 months.
Oh gosh. Okay.
And then there's some new products that have come onto the market, like exosomes, polynucleotides, things that are injected that stimulate your skin to produce collagen. So, usually when I'm seeing someone, it's combining a few of those things to really like supercharge the skin to produce more collagen.
What about ingesting collagen?
Yeah, look, ingesting collagen is great as well. I think there's lots of new and upcoming evidence in that space. I guess certainly the role of like nutritional supplements and gut health is really important. And when we know that the more we can nourish and support, particularly our gut microbiome, the more we can improve our skin health as well. And there's a really interesting like skin gut axis that again, there's more and more research coming out each year.
Yeah, collagen's great for the gut too.
Totally.
Right?
Yep. As like a prebiotic as well.
Yeah.
And something so basic is I know when I eat well and I cut out the sugars, which is not very often, but when I do cut out the sugars for a day or so, like my skin just is glowing. And it's like those basic things where it's like, yes, these treatments are all great, but you've also got to get, like you said, you got to get back to the basics and you got to think about it in a holistic way. So that's really important. 100%. So maybe I won't have chocolate today.
No, that's it. And that's what got me started on this whole journey about loving skin health and interest in gut health and things like that, because I actually had to heal my gut from burnout. And I noticed the biggest difference I noticed in my skin came from my diet, sleeping better, less stress. And then now when I do get treatments every now and again, and my skincare, I've had to, it's reduced now. I don't spend as much on it because I'm doing the holistic approach, which is
which you don't think about when you're in your 20s.
You just try to do the Band-Aid thing. And I think if you want longevity out of the treatments and the things that you're doing and better results, it's having the foundation first.
Are there any sort of early warning signs that you can see on someone that collagen is breaking down?
Yeah. So one of the things that I like to do with patients when I'm assessing them in my clinic is what's called a pinch test. And so for example, do you
want to do it on me? Can you tell me how much collagen I have?
I mean, we can. So like if you pinch your cheek there, right? And then if you let it go, you'll see, maybe if you see on Christy, you'll
she
see.
Hasn't got much
I'm over 40.
Yeah, if you pinch her and then if you let it go, you'll see the skin like bounce back really quickly,
bounce
right?
back?
It did. But then what you'll see,
30.
like
everyone 32 next week.
Heaps of collagen. But as you're starting to lose collagen, particularly around the eyes, if you do that and release it, you'll actually often see it be quite slow.
Okay, I'm going to do it.
You've still got plenty of collagen.
Yes.
But if you start to see that slowing, it's a sign that collagen loss has started to occur, right?
Okay.
But that's where you tend to see it first, is around the eyes. Then you see it on the neck. Then you see it around the mouth, and then you kind of see it globally. So when you're starting to see that pinch test slow around the eyes, that's a sign that you want to intervene. It's like, I call it the canary in the gold mine. So you want to intervene at that point. and try and reverse some of that damage, as soon as you can. But that's an early sign of collagen loss.
Yeah, it's interesting.
Yeah.
Someone in their 20s or around 25 versus someone in their 40s around 45, we have been talking about it declining as soon as you hit 40. Is that true? Like, do you hit sort of 40 or close to, and then all of a sudden it just drops?
Yeah. So you have those, like I said, bursts of aging, and they occur at 40 and 60.
40 and 60.
And so that's just like a biological thing that we know happens.
So do you mean, it's going to drop at 40 and then again at 60, you're just going to see this really big drop?
Can I look 40 for the next 20 years is the question. Pretty much.
Look, you can definitely try.
Yeah, I'm going to try.
No, but is that, so it's just at 40, you actually just see this massive drop in collagen and everything relating to your skin. And then again, it's all of a sudden you hit 60 and then again, it just
That's when we get
drops.
the facelift.
Yeah, that's what a lot of people do. So I guess that's where we can talk about the concept of collagen banking.
Okay.
And so the idea behind that is to try and stimulate and bank as much collagen as you can when you're young and your body is very responsive to it.
How do we do that?
So those are all of the things we spoke about. So your skincare, your actives, lasers, the regenerative aesthetic treatments. And so
that's good. That's good to know. So you can like bank your collagen.
Because I think that too when I have my collagen supplement, it's just like, I'm like banking it.
Yeah, banking it.
Topping it up, doing all my things. Yeah. I like that. Okay.
So there's lots you can do. That's the bottom line.
All right. I want to talk about one of my favorite topics to talk about on the podcast because I've spoken about quite a lot, but it's rosacea. Because I have rosacea and I still struggle to find the right things to use on my skin, even know what to do. And it kind of stresses me out, especially when we talk about sunscreen a lot, because for me, I put sunscreen on my face and I go out in the sun and I feel like I've got like heat rash on my skin and it's not good. So I'm like, do I avoid sunscreen? Do I avoid the sun? What do I do? So can you kind of basically tell me everything I should do in relation to having rosacea and sunscreen and skincare?
Totally.
Just everything basically.
I feel you. I have rosacea too. And I treat lots and lots of it in my practice. And many people, I would see probably say 1 in 4 people I see have rosacea, and quite often they don't even know they have it. So I guess to kind of go through the 101s of rosacea. So the first thing I would say is trigger avoidance. So avoiding things that make it worse. And the 3 most common triggers by far are heat, UV radiation, and active skincare. And so what I see a lot of when I see patients is they're using too many products, and often too many products that are very irritating on the skin. So one of the first things I do is pare everything back and work on repairing their barrier function. So that's using really bland skincare and building up that resilience in their skin again. And
so
then
you can build it up.
Totally.
Okay.
Yeah, you totally can. But the first thing is actually stopping most stuff. And there's some actives that are just very irritating. So vitamin C is a good example. Most people with rosacea don't tolerate vitamin C topically. But there's lots of things that you can do. So the first thing is barrier function. So using a moisturizer with lots of lipids and ceramides in it to nourish that lipid barrier, and then not over cleansing the skin. So ideally using quite a gentle cleanser, not using something that's too stripping of the skin. Then I incorporate one active. And so for me, it's a compounded skincare product, and it combines niacinamide, which is vitamin B3, azelaic acid, which is an anti-inflammatory skin active, and a medication called ivermectin. So ivermectin is an anti-mite agent, which sounds really gross, but we have mites on our skin, which everyone does. But in rosacea, they overgrow and they sit in the hair, in the sebaceous glands, and they kind of go crazy. And so the little bumps on the skin are these little micro populations of mites. So using this nightly just keeps that mite population at bay.
So they'll always be there.
They will, unfortunately. They're just part of the normal flora of the skin.
Now I was like picturing these little mites.
No, same. I was literally like these mites all over my face. So.
But
don't Google it.
Don't Google it.
Gosh, don't Google that, people.
The other thing is vascular laser. So vascular laser in particular for rosacea, it cuts the inflammatory cycle. So when you've got rosacea, you often see people with quite flushed cheeks. And so those little micro vessels are actually not really functional that well. So shutting them down just pushes that blood back through the more functional vessels sitting underneath, and it takes the redness out of the skin. The final thing is oral niacinamide. So oral B3, 500 milligrams daily is the dose we prescribe for rosacea. And again, it's just a really nice antioxidant and anti-inflammatory for the skin. So that's kind of my like 101s of rosacea. And then I'll just, once we've like built up that resilience, decrease the inflammation, then slowly adding one active in at a time, but in priority of like highest yield. So, you know, once I've got their skin under control, then I'll usually try and introduce a retinol or a retinoid because we know that that's where all of the evidence for anti-aging is.
And I'm heading overseas. I'm going to Europe. It's going to be very sunny. I'm also going to Bali. It's going to be so sunny. I struggle with finding a really great sunscreen. And someone did recommend there was a powder sunscreen. I don't know if that would work, but what would you recommend when it comes to sunscreen and someone who has rosacea? Yeah, no, great point, because sunscreen choice for rosacea in particular is very important. And I would always recommend a zinc-based sunscreen. So because, chemical sunscreens, two reasons they're not great for rosacea. One, it's that they're a chemical that's absorbed into the skin. And so that in itself is an irritant. But the way that they work, we spoke about converting ultraviolet light to heat. That heat is also a trigger for rosacea. So for two reasons, they're not ideal. Whereas zinc in itself is anti-inflammatory, it's not absorbed and it reflects that light completely. So always for rosacea, I would recommend a zinc oxide. The one that I really like, and I have no affiliations with this company, but I really like the Everyday Mineral Mousse. It's really lightweight. It's just a zinc. It's also a primer. So for ladies who wear makeup, it makes their makeup sit well. But that's what I use and I really like it. And is that good for your body as well? Because sometimes even when I put sunscreen on my body, on my chest, I feel like as soon as the sun hits it, again, I feel like I've got this heat rash all over my body. And I don't know if that's from the sunscreen or if it's just from the heat. It could be, it could be both. I don't tend to use it on my body because it doesn't, you can't buy it in bulk, so you need to use quite a lot of it. Mineral sunscreens are more expensive because it's a mineral versus a chemical. So I tend to just use it on my face and my neck, and then I'll use like a cheaper Hamilton or other sunscreen for my body. And when it comes to sort of other things that we can do when it comes to rosacea, I know there are those triggers. So it's like, do I have to avoid, red wine, chocolate, sun, all these things? Like, I just did a reformer class the other day or a Pilates class in like a heated room. Yeah. I'm like, I don't want to avoid those things because I love them. It didn't actually impact a lot, but I find it's interesting when I wear makeup. If I go on a treadmill and I run and I have no makeup on, I look like a beetroot. My face is so red afterwards. But if I put my makeup on and I wear foundation that doesn't have any oils in it, because when I went to see someone, they said avoid oils. Yeah. And I find that when if I am running on the treadmill, my face is not nearly as red. Obviously, it's covered, but I feel like I almost need to wear that on a daily basis. Even when I went to the reformer class, like if I went without any makeup, again, my face would be a beetroot. So that's because of how rosacea affects the blood vessels of the face. So you most likely have very superficial, quite dilated microscopic vessels, but those are very easily treatable with vascular laser. So you can literally shut down those vessels that aren't functioning, perfectly. And then you just won't have that ability to go really red. So the better we can control the inflammation, the vascular component, and just rosacea in general, the more likely you'll be able to tolerate some of those triggers. So like hot yoga classes, hot showers. If you're very reactive, you might want to start by doing that. But once we get it under control, then you can probably tolerate that stuff a lot better. So there's hope. Totally. Yay.
I have a question about hormonal changes and our skin changing as well. And this is asking for a friend because we know that perimenopause goes for about 10 years and we have hormonal fluctuations. And I know that some women will experience hormonal acne and things like that. What can we be doing to help prevent things like hormonal acne during times like perimenopause or PMS?
So one of the best ways to kind of treat acne at any age, but in this context, perimenopausal acne, is to regulate the cell turnover in the oil gland. And so the way we do that is with our retinoids, so our prescription vitamin A's. So certainly someone that's later in life or more mature skin, I'd always incorporate a prescription retinoid like tretinoin, because that will help with aging, it'll help with collagen, but it also helps regulate those two things. The other thing that happens, the hormonal changes that happen in the skin, is we lose collagen. So at menopause, the following 12 months, ladies will lose about 30% of their collagen in that 12-month period. So it's a lot, right?
Whoa.
And so we really want to kind of prepare for that. And that's kind of going back to that collagen banking. But around that menopause age, it's so important to be doing all of those preventative things, because you can mitigate that loss if you're doing the right things.
So what's the biggest lie you think the beauty industry is telling us today?
So I would say the biggest lie that the beauty industry tells us is that aging is a pathological process or a disease. And I really think that aging should be embraced. And I often say that it's a privilege that not everyone gets. But it's not something that we should be afraid of. And it's not necessarily about not aging or even anti-aging, but it's just aging well. Or I like to call it positive aging. So that's where I think we're sort of seeing a paradigm shift in how we view aging. And I think it's a more positive one.
Yeah, I do as well. And I feel like now, like you said, it kind of has gone away from that whole anti-aging. You don't hear that as much now. I love the positive aging or positive, what else was it? The aging well.
Aging well.
I thought that was really nice as well.
What about the mindset? How much does the mindset have on aging? Like how you think about yourself?
I think it's there is a mindset shift in how we're viewing aging. And I think more people are embracing it. And, it's not necessarily about, 10 years ago, it was all about like stopping wrinkles at every cost, right? And these days, we actually want to keep some lines on the face. We actually want to keep animation in the face and for people to be able to show animation. So I think there's been a mind shift in also, the consumer or the patient, and one that I think is a positive one.
And what's one of the biggest mistakes people are doing when it comes to preventing aging?
I would say focusing too much on one thing at the expense of everything else. So, we spoke again about that 3-dimensional aging. If people are just focused on the volume loss, they're going to start to look unusual as they just add more and more volume. So I think it's taking a more balanced and holistic approach to their aging, where they're considering their lifestyle factors and how that's influencing things, considering their nutrition and their gut health, their skin health, and just taking that more 3-dimensional approach to aging.
And when patients come and see you or any cosmetic physician, what questions should they be asking in order to get the best results?
So I think one question that doesn't get asked enough is the clinician's credentials and experience. There are, unfortunately, in the industry, there's a very wide variety of skill sets and experience levels. And I think it's important that, patients do their research in who they're seeing, and that they can, put trust in that person to help guide them and make the right decisions around their treatment planning and the aging process.
And just on social media trends, you've got TikToks, all of those things. And there's so much on this at the moment. Everyone's putting something on their face. What sort of trend are you seeing at the moment that's actually causing the most damage?
So I think, there's a lot of at-home sort of skincare gadgets, and a lot of them have the sort of promise of, medical grade results and, amazing results, but there's often little oversight. So it's not that you can't use them, but I think if people are using at-home, beauty devices, they should at least have some, supervision by some sort of either medical or skincare professional, just to make sure that they are doing the right thing and not causing harm to their skin. One exception to that I really love is like LED face masks. I think they're awesome, and they're really nice for like inflammatory skin conditions and regeneration and things like that. But even those carry some risks, and they're not for everybody. People that have a light base or pigmentary issues, they shouldn't, be using the LED masks. So I guess the bottom line is just to have someone involved in your care that can help guide you.
Yeah, that's good. I've actually bought a few things off.
I've got an LED mask.
I've got an LED mask as well, which I'm glad I have. I love that. But I have bought some interesting things. I bought something that it was going to lift my face after about 2 seconds. And I was like, well, no. And it was like burning. I was like, I probably shouldn't have bought this. So I definitely need, a little bit more guidance on that one.
But the LED masks, I guess in order to get any results, it's something you have to use daily.
Well, you can certainly overuse them as well, because depending on the wavelength of the mask, they can actually stimulate pigment, certain wavelengths. The blue light wavelength can actually cause photoaging.
Is it blue? Because I've got one that's red.
Most of them would be red. Some of that in
I
clinic
do have
ones
one that has changed.
Yeah, you can sometimes change them to different wavelengths.
Okay.
So I guess you've just got to be mindful that these are sometimes powerful things, and they can carry side effects if they're not used properly.
Do you know much about infrared saunas and what impact they have on the skin?
I believe that there is a degree of, photoaging that can occur from infrared saunas. I mean, probably not to any great extent just based on how much time you spend in there. But certainly photoaging is not just from ultraviolet light, it's from the entire spectrum of light. And so if we break the spectrum of light, you've got ultraviolet, then we've got infrared and then visible, and we get photoaging from all of that. And in
even
fact,
this kind of light?
Yeah.
Right.
And in fact, a really common one is blue light. So, people often say to me, if I ask them if they use sunscreen and they say, I don't go outside at all, it's actually not even just ultraviolet light, but even sitting in front of a computer screen, you're still getting photoaging, which is why it's so important to be using a sunscreen every day, because it is going to protect you from that as well.
Even inside.
Inside.
So like sitting at your computer, I guess. And if you're sitting
on.
I know, because I've got my computer, then my window.
Yeah.
But I do put a zinc sunscreen on every morning, but I don't reapply it because I've usually got makeup on.
Yeah, that is tricky. That is tricky.
What about the spray sunscreens?
Yeah, look, that is better than nothing. Yeah. I always encourage people, if possible, to use a zinc-based sunscreen, just because how sunscreens work. And if I can go into that if you like.
Yeah.
So I guess broadly speaking, you've got chemical sunscreens and physical sunscreens. And so the way that chemical sunscreens work is they get absorbed into the skin and they convert the ultraviolet light to heat, and the heat is released. And so that's how obviously you prevent damage to your DNA and whatnot. But they'll only block ultraviolet light. They don't block any other part of the spectrum. Whereas zinc and titanium oxide, which are your physical sunscreens, they sit on top of the skin and they actually just reflect light. But
like a barrier.
Exactly. It's like a barrier. But they reflect the entire spectrum of light. And a lot of aging is, like we said, is from visible light. So it's helpful in preventing that photoaging. The only one it doesn't protect well for is very high energy blue light. But that's really only an issue if you've got melasma or like pigment issues. And so that's when they'll add in iron oxide or a tint to the sunscreen. But for most people, a zinc oxide is perfect for aging and prevention of pigment.
I was actually going to go back to injectables and surgery. Has there been a really dramatic before and after that you've seen with one of your patients that actually doesn't involve injectables and surgery? And what is it?
Totally. We do it all the time. So in my practice, so Ascension in Brisbane, we take a very skin first approach. And so we will always start with getting their skincare right, but also incorporating laser and energy-based devices. And some of the results that you can get just by doing those things is incredible. And there's certain people that they don't want to do injectables. It doesn't appeal to them. So, but you can get amazing results just by doing those things really well.
What about for someone who's on a budget and wants glowing skin, less wrinkles, firm, hydrated skin? Yep. What can they be doing? What would be the top 3 things someone on a budget could do to help prevent aging, wrinkles, and improve skin hydration,
Sunscreen is
etc.
one I can add to that.
Sunscreen will be one.
So honestly, if you're on a budget, the best thing you can do by far is get your skincare right. It is the lowest hanging fruit and it is by far the cheapest thing that you can do. So yes, of course, the sunscreen, but getting on some good prescription actives, incorporating an antioxidant like vitamin C or resveratrol into your regime, and then using evidence-based actives that we know work. So those are things like our retinol and retinoids. So, you know, for a few $100s, which lasts 3 months, you can make a massive change to your skin just by making some simple, you know, tweaks. So that's where I would start if someone was on a budget for sure.
And what if, okay, put budget aside, if you could have 3 treatments that you could use for the rest of your life and only 3, what would they be? And don't worry about the budget. Very expensive.
So I would say probably 3 energy-based treatments. So that would be the 3 we spoke about earlier. So Morpheus 8, Ultraformer, and Wonderface, which is the treatment that focuses on muscle stimulation. If you just do those, like you're tightening the face, the layers of the face, you know, you can keep your face really tightened and lifted over time.
I'll just make
if we're putting injectables aside, it would be those 3 treatments.
Yeah, cool.
Good.
Amazing.
What makes you feel confident in your skin?
So for me personally, feeling confident in my skin is getting all of the lifestyle things right. So really prioritizing getting enough sleep each night, you know, eating well, exercising throughout the week, and just doing those, my skin health has improved. So, you know, for me, that's feeling confident in my skin.
Yeah. Same for me. I'm like, if I've had a good night's sleep, I'm like, I can conquer this day. I can conquer the world. It's like, just give me a good night's sleep.
And look, it doesn't happen every night, but like I try.
I think that's it.
Yeah.
Thank you.
Awesome. Thank you for having me.
Well, thank you so much for joining us. Where can we find you on social media or your website?
Yeah, so my clinic is Ascension Cosmetic Medicine. We're in New Farm in Brisbane, ascension.com.au. And you can follow me on Instagram, Dr Scott Allison.
Great. We'll add that in the show notes. But thank you again for joining us.
Thank you for having me.
Thank you.